Welcome back. You're watching SABC News Channel with me, Unati Bagyashe. The C19 People's Coalition Community Working Group has strongly opposed the Department of Health's vaccination registration process. The group says the registration system as it is currently used is a true reflection of the fact that the South African government prioritizes profits over people's lives. Now, to discuss this further, we are now joined by Simphiwe Zwane from the C19 People's Coalition Community Working Group. Ma'am Simphiwe, thank you so much for joining us. Now, you say the registration system currently as it is not working. Talk to us about what you would like to see and how you would have liked government to handle this.
Okay, thank you. We are working with the community almost every day on the ground. We were so interested with this thing of registration. So our concern, it was, we wanted to know how the old people are going to register, because they need to have phones and stuff. So number one, we found that some of the old people, they don't have phones. And so that it became a problem to us. That is why we choose to say this thing is not working. But we suggest that maybe the government, if he can provide mobile clinics around our township, where the elder people, they can just walk not a long distance and register themselves there. I think it can be easy. Or government, at least the front liners, should maybe go door to door and register people, try to register people. Or the field workers. I mean, we have this field workers from the health department, your Josie at work and whatsoever. They can at least assist on registering, because it's a challenge for the old people, really.
Simphiwe, now you work very closely with the communities. Now, a research project that you recently conducted as an organization together with UJ, you found that many people are still skeptical about even taking the vaccine itself. Talk to us about what's happening on the ground. Just some of the people that you've spoken to, what are they saying?
Okay, number one, there were a lot of rumors around the social media. So obviously, people, they see that and they spread lies to other people. So it's where the problem started. But now, that is why we are trying by all means to assist so that people can go and register, and others can see, like what we did with Gogo Emily, Mama Emily in Protea South. So people now, they want to do e-vaccination. I think the problem lies with the rumors, the rumor around the vaccine, that there's a challenge, you'll get sick, you'll have clots and stuff, headache, you'll get sick more, you'll die within 3 days. The problem here is probably not enough information from our government side, no popular education from our government side, and not everyone has a TV. Because there are some other informal settlements that don't have electricity at all. So people are not capable to see news at some point. So government should have maybe tried to do something to inform people about these things, kind of things.
It also seems that there is a lack of that community information from government side. Now, as a working group, as a coalition, there's only so much you can do. Do you find that you are working with other organizations to try and remedy this situation? Have you come up with proposals directly to the Department of Health? How have you tried to remedy the situation with government specifically?
The challenge that we are having, obviously, government doesn't listen to minor people. And to make it worse, as C19, we are not a registered organization. So that's another challenge. But obviously, we cannot sit without, or we cannot just sit and leave things loose the way they are. We need to do something, because we care for our communities. We love our citizen people who are living in South Africa. We love them. So that is why most of the time we risk with our lives. We volunteer ourselves to talk to our people, of which is what our government can't do, But I can say our plea to our government, they need to recognize such people, because they have information, because they talk to people daily, they do things within their community with other people. So I think it's high time for our government to recognize people who are doing things on the ground, especially voluntarily.
Now, when you see other countries, especially our neighboring countries like Zimbabwe as an example, who've already vaccinated over 1 million of their nationals, what's your reaction to that?
From our side, when looking at it from our side, it's very disappointing because that tells that our government didn't have a clear plan on enrolling the vaccine. So I think they need to go back to the drawing board and making sure, though they don't have to stop this process that is, already is there, carrying on with the process, but at the same time, bring a plan B on board so that it can be easy and people can be get to the vaccine point very easily. Like for instance, like here I'm at Tembelihle right now. To go to Extension 5 clinic, I'll have to have something like 33 rand to get vaccinated. So that is another challenge for the citizens. Where else maybe government can just put the mobile clinics and people can go just near, not using even any cent.
Simphiwe, just to wrap up our conversation, you've mentioned some very interesting alternatives for government as opposed to just using the electronic vaccination data system. But you've also said that because you're not a registered entity, but you are a working group within the communities, I'd really like to know how you will then take these, some of these alternative measures that government can take and make it implementable, because you're raising some very interesting points in that one of the main reasons that people aren't going to vaccinate and going to these centers is because they are inaccessible.
Yeah, I think it's high time, or in this situation that we are currently in now, that is not even pleasant to anyone. I think it's high time for a government to come down and be on the ground with people, do the research with people so that we can go somewhere. For an example, already I have a solution. I think something that it can be a solution, maybe in a case of the places where people should be going, instead of going far, the mobile clinics. But if government cannot provide the mobile clinics, government should also think of providing transport for people to go and vaccinate to those clinics that are there already. And also, again, there's something that I spoke to someone who already had vaccinated. There's an issue of Panados that will get vaccinated, and immediately after that, the nurses will tell you that you need to take a Panado. Then the question it will be, why government not providing a Panado? Why this doesn't come as a package? You vaccinate, then you get a Panado at the same time. So there are a lot of challenges. I think our government needs to do a lot concerning this pandemic. There are a lot that need to be considered.
Talking about a lot that needs to be considered, because you work on the ground with communities, do you see any of the adherence to some of the regulations that we are told to adhere as South Africans, wearing of masks, social distancing, etc.? What are some of the things and the scenes that you're seeing currently there?
Yes, wearing a mask, it's a challenge. I remember 2020, around April, as a cow or C19 member, we went out to do a popular education to people. People were so ignorant, not wearing their mask, but we tried our best to run campaigns or awareness to say, mask up. I remember that there were one time where we did a roadshow where we painted walls where there are big space to say mask up always. We write different messages on our walls because we wanted to save our citizens. And also, again, we educate people. We used to educate people about the regulations. We'll go to door, wearing our masks, having our gloves, and having our sanitizers. And then we'll be educating people that the important things that I need to do is to follow the regulations. Though it was a challenge to some of them because they were like asking that, okay, we don't mind sitting inside. But at some point, we see that it's better to be outside looking for food to eat rather than being inside, be killed by hunger. Those were the challenges that we were met with at some point. But people were trying by all means to obey the regulations, but it was so hard. It was not an easy thing. And recently what I saw, most of the people, they stopped wearing the mask. I don't know, it's whether they used to COVID, but now since the announcement of the third wave, people are starting again now to be scared. I see them, some they used not to wear their masks anymore, but now I see people wearing their masks, starting to wear their masks.
Simphiwe, thank you so much for your time. And, the work that you do is important and it is vital. So we see it. We will try and see how we can take this story forward and follow up with the Department of Health as well as government, just in terms of some of the suggestions that you are making, because you are spending time with people on the ground. Thank you so much for your time this afternoon.
Thank you.
That was Simphiwe Zwane from the C19 People's Coalition Community Working Group. We'll have more of your top stories when we return. Stay with us.